my name's Melissa. I'm going to be your student nurse today. Can I have you tell me your name and date of birth? Okay. I'm going to check your ID band. Great. Alright. Well, it looks like your doctor has ordered NGTube because you aren't able to eat and you've been losing a little bit of weight. So we want to get you some extra nutrition. So I'm just going to evaluate you for the insertion of the NGTube. So I'm going to just start by listening to your abdomen. Okay. Have you had any surgeries or injuries to your nares? We're going to be inserting the tube through your nostrils, so we need to examine them to make sure that we're going to be able to do that. Okay, it looks like the your left side, there's a little bit of an obstruction, so we're probably going to start with the nasal passage on your right side. So I'm going to go talk to the other nurse, and she's going to be in to start the procedure. Is there any concerns that you have? The procedure's going to be a little bit uncomfortable, but it shouldn't hurt.
My name is Denise. I'm going to be your student nurse today. Let me just check. What is your name and date of birth? Okay, very good. It looks like today we're going to be inserting an NGTube. It was ordered by your doctor. Melissa did your assessment a little bit earlier, but I'm going to be inserting it. And she noted that you had an obstruction in your left side, your left nostril. So I'm going to be inserting it into your right, and you shouldn't experience any pain with this. It's probably just going to be a little bit of discomfort. But if you do experience any pain at any time, please just make a hand gesture like this in the air, and I will stop. I'm also going to have Melissa assist me with your swallowing, because during the whole procedure I'm going to need you to swallow. Okay, and I'm just going to raise your bed. And I'm just going to measure the tube. Here to your nose, and then down.
Oh yeah. Well, that's what good to do. But you get to use the finger up to this one anyway. Right. You see at the Yankees to this, if it was hooked up to the wall. Yeah. I don't care. Vomit, love it. But I can.
And then I'm going to lubricate the end of this. Okay. And I'd like you the whole time to swallow as I'm inserting it.
Oh, you didn't cry in front of the patient.
No, the patient was like hilarious.
And just keep swallowing.
Didn't know what was going on.
Swallow. Swallow.
But still, like,
Swallow.
Yeah, I mean, you know, we can be in the nurse's station.
Okay.
But we certainly don't think.
How are you doing? Are you okay?
Like wounds and stuff like that.
yes, you medical records printed over.
When we go there, an hour.
Alright. And then I'm just going to check for placement for the residual. So I'm just going to put some air in this syringe, about 30 mLs. And then I'm going to listen to your bowel sound as I insert some air. And now I'm going to check for your residual. So we have the 30 mLs of air and 10 mLs of residual. So I'm just going to verify the pH. And it looks like the pH is 3, which means it's in the correct place. And And then I'm going to fill this syringe with 30 ml of water. And I'm just going to flush the tube after I had your residual. Checked your residual. We're going to take you in and do a chest x-ray just to be sure that we have it in the proper place. Alright, do you have any questions for me before I go? No? Okay. I'm going to lower your bed. I'm going to clean up my equipment. Take this with me.
Good morning, Mr. Berger. I'm Ashley, student nurse. Let me just check your armband. What's your name and date of birth? Okay, great. So we checked your x-ray and the tube is in the right place. Now I'm just going to check for the residual. Okay. Put some back. Leave a little bit in the tube so that I can check the pH. Okay, the pH is good. It's 3. So I have primed the feeding. I'm just going to set it up in here. Alright, and then I'm just going to turn it on. Put the infusion rate at 30 per hour. And if you tolerate that okay, we'll increase it to 40. Are you doing okay? Having any pain or discomfort? No? Alright. Okay, and I'm going to put this label with your name, the date, and time that we administered the feeding so that, and my initials, so we know when to change the bag and the tubing. Okay. And if you need anything, you can just call.
Hi, Mr. Berger. I'm just going to check your ID band. Can you tell me your name and date of birth? Okay, great. I'm going to raise the bed up, and I'm just going to be listening to your abdomen. Are you feeling any nausea or discomfort from the feeding? It seems to be going okay.
And it does tell you on the top of it.
Okay, sounds good. I'm going to go ahead and document that you seem to be doing well with this feeding. And if you have any questions or concerns, you can call us.
Okay, Mr. Berger, so I've checked the doctor's orders and he's ordered you to have your NGTube removed. Stopping your feeding. And you're just going to hold that there. And I'm just going to put some air in here to clear the tube. And then I'm going to have you take a deep breath. Are you feeling alright? Do you have any discomfort right now? Call if you need anything.
Okay, great. Sounds good. So it sounds like you're doing better with the feeding. So, all right. Well, I think we need to raise the bed.
So you're familiar with what's on the wall?
Hey, Melissa. Probably want to raise that bed. Shouldn't you raise the bed again before you put on the gloves? We'll just kind of do a little.
No, it's the other one, guys.
Oh.
Use the clear one.
Okay. Cut.